Hello people, in this video let's look at this child, Marasmus affected child. So this is a child affected with marasmus. It is less than 1 year old, and here this topic is coming under protein, energy, malnutrition. Okay, so here you can see this topic is coming under what? Protein, energy, malnutrition. But here actually in marasmus, if you see here, the serum albumin is actually normal. Are you able to see here? Are you looking at the right place here? Serum albumin is normal. Okay, so then what exactly is the problem here? So let us look at it one by one. This is age of onset is less than 1 year. So it is a small child. Okay, and here there is low calorie intake. That means the entire food is probably less, right? The low calorie intake, right? So it could be a premature baby, underweight. So it has low calorie intake, okay? Or it is being breastfed by a malnourished mother. Guys, are you understanding what are we looking at today? We are looking at this child here, Marasmus. Look at it again. So this is less than 1 year old. It is malnourished, low calorie intake. As such, the entire thing is down on it. No, in the food wise, less food. It is being breastfed by a malnourished mother. So it could be a premature baby, underweight. So the body weight is less than 60% of normal children, okay? So the weight will be less than 60%, imagine, of normal children. The growth is severely retarded. Edema will not be there here because the serum albumin level is normal, right? So edema will not be there. First analyze it. So if this is the blood capillary, right, of the child, and here you have serum albumin is normal, then definitely no edema, right? So you understood that. How does the face look? Like an old man's face. And let us look at that. Abdomen is shrunken. Let's look at this. Abdomen shrunken, old man's face. Is that true? So, old man's face doesn't look very old actually in this. And abdomen is shrunken. This is a marasmic child. Then, skin. Skin is dry and atrophic. Muscles are weak and atrophic. Okay? What is atrophic? Atrophic means the size is less, isn't it? That is what is atrophic. It could also be less size, less in number, both of them. Okay, atrophic means that. So the skin is very dry, atrophic, and the muscles are also weak and atrophic. What happens to the subcutaneous fat? No fat, no fat. Why? Because this person is having all types of deficiency. His entire food plate is very less. So basically you look at this child, protein is less, right? You can see here protein is less, carbohydrate is less, fat is less, everything is less. Everything is less. So now look at this continuation, okay, marasmus, we will look at this now. So basically here we were, subcutaneous fat is absent, yes, because this child has no fat, yes. Then, vitamin deficiencies are present. Yes, of course, vitamins are also less. Yes, vitamins are also deficient. So, we'll put it like this. Vitamin deficiencies. Deficiencies. That is a better thing. Vitamin also is red only. Deficiencies are there, right? So, vitamin also deficient. Then, what about serum albumin? Somehow the serum albumin is normal, which is very strange. The serum albumin has no issue. That is able to survive nicely. So there is no edema. Then something else is normal. What is that? Serum potassium. Potassium is also normal in this person. Okay. What about cortisol? Cortisol is increased. Fasting blood glucose. Glucose is less. Yes, because obviously this patient is taking less food. Glucose is less. But somehow mysteriously the albumin and potassium are serum albumin. That too. Serum albumin, serum potassium are fine. Strange, right? So that is marasmus for you. So where are we now? We are here in marasmus. So again, let us see marasmus. What are they saying here? Monkey face. That they said old man's face, monkey face. It is hungry. Yes, the child is hungry. The child is crying. It has prominent bones because subcutaneous fat is less, right? And there is loose skin. Subcutaneous fat is less. The skin also dry, atrophied. So the skin is loose. So less subcutaneous fat. Hence there is bony prominence. So this is the marasmus child for you. This is protein, energy, malnutrition. Under that it comes, but here not protein, but everything is less. But strangely, the albumin, serum albumin is normal and hence there is no edema. Abdomen is shrunken here. But when it comes to kwashiorkor, the abdomen is more. Okay, why? Because this person has edema. Okay. This person has no edema. Marasmus child, no edema. Guys, just remember here that the serum albumin thing, each textbook is telling different thing. Okay, some people are saying it can be slightly less. Some people are saying it can be more also. But it is not significantly less. Okay, that much you remember. Serum albumin is not significantly less. Something like that you remember. Okay, hence there is no edema. So, as the edema is not there, you can try to remember abdomen is not protruding. It is more like shrunken. There is no subcutaneous fat. Okay, so that and all you remember. So, look at the plate of this child, how this plate of the child looks. Actually, there is less food on it. Less. Remember, less food. Okay. Overall, all the types of food is less. Okay. So, how will the child look? Old man face or monkey face. It is hungry, 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 crying. Because less subcutaneous fat, bony prominence. The skin is what? Dry, atrophic. The skin is loose, they are saying also. And what else? There are prominent bones. Bones are prominent, then it is marasmus. Whenever you see bone prominence, marasmus, marasmus, marasmus. Okay. So quickly let us look at marasmus again. Less than 1 year old, all types of food are less. There is no edema. There is no fat, right? Fat is also less. All types of food are less. Remember, basically there is no edema, no edema, no edema, no edema in marasmus. Bony prominence, bony prominence, bony prominence, bony prominence. That's all you have to say. Bony prominence, bony prominence, bony prominence, bony prominence. Okay, this video is over. We will meet you in the next video. Bye-bye.